HKIB's channel. In this video, we're going to walk you through stem cell therapy. I'm sure you'll find it interesting, whether you want to learn about latest technology or the medical industry. I asked a few of my friends what they'll think of when I say stem cells. Many of them told me that they will think of really advanced treatments. It doesn't seem that this term is something they're exposed to in their daily lives. It may actually surprise you that stem cell therapy can be traced back to 1958. To begin with, let me introduce to you what stem cells are. They have two main processes. The first one is to undergo mitotic cell division and form new stem cells. The second one is to differentiate into various specialized cells with specific functions, like blood, brain, bone, cartilage, muscle cells, which all have their own processes and functions. These two processes contribute to repair and regeneration. Hence, stem cells have the potential to create new cells, tissues, and organs. There are several types of stem cells. Let me brief you on two of them. The first one is mesenchymal stem cells. They are found in individuals past the age of embryo. Their ability to differentiate into specific types of cells is more limited. They can be isolated from bone marrow, fat, umbilical cord tissue, etc. The second type is embryonic stem cell. They are derived from very early embryos and can differentiate into any type of cells. However, the use of them raises ethical concerns. They are more commonly used in research purposes because they are more versatile. This video will be split into two parts. Part 1 will be cartilage mesenchymal cell therapy, while Part 2 will be about the accessibility of cell therapy. Cartilage mesenchymal cell therapy treats osteoarthritis, or OA, which is the wear and tear of joints cartilage. Due to the joint's avascularity, it has limited repair ability. The risk factors include athletes, obesity, injuries, and load-bearing jobs. The Beijing OA study shows that, in the population group of aged 60 years or above, the prevalence of radiographic knee OA was 43% in women and 22% in men, and symptomatic knee OA occurred in 15% of women and around 6% of men, showing that OA is a common problem. Let's take a look at existing solutions for OA. One of the most common ones is microfracture. Several holes will be punched in the surface of the joint, and this will induce cells to undergo repair at the area. And there is also autologous chondrocyte implantation, which means that chondrocytes, or cartilage cells, from the same patients are obtained in other areas and then implanted. As for MSC-based therapies, we have MSC implantation, which actually means the implantation of MSCs directly at the cartilage, and sometimes inducing factors or scaffolds will be incorporated as well to induce better repair. Today we're going to talk about MSC implantation. The process is pretty straightforward. Mesenchymal stem cells, or MSCs, are harvested from the patient's bone marrow, usually at the iliac crest or hip bone. And then, using fluorescence or magnets, we can isolate these cells that we want. And then, through culturing, we can make a larger number of cells and finally transplant them back into the cartilage damaged area. Intra-articular injection of MSCs can improve pain and functional properties by stimulating cartilage regeneration, and this is shown in several clinical trials. The body is able to produce various ECMs during differentiation, and they will release various cytokines, growth factors, and chemokines, driving endogenous MSCs to enter lesion areas and creating an appropriate regenerative microenvironment. The advantages include that it's simple, minimally invasive, and efficient. However, through only using intra-articular injection, but not use of scaffold, there may be a higher disappearance rate of MSCs. We just had a dip into the whole process. Now let's take a look at it from a more personal perspective. What do the patients encounter or experience throughout the whole stem cell journey? First off will be the diagnosis of the disease. The doctor will help the patient with the management of symptoms and pain through prescription of relief. And then the doctor will also help the patients understand the effects and implications of OA, such as the duration and the prognosis of it. And then the patient also has to seek support from peers, family, or community resources, as it may be a difficult time for them to accept that they have been diagnosed with this disease. Next is consultation for treatment. The doctor will guide the patients through different treatment options. The cost, prognosis, success rate, potential side effects, traveling time and leaves will be considered. The patient will be encouraged to discuss with family and friends and to navigate information and other people's experience. Not all treatments work perfectly on all individuals, and therefore alternatives have to be explored as well. Regarding finance, the patients can look into their insurance coverage and the cost of hospital and doctor bills. It is important to manage their expectations because the surgical results may be suboptimal sometimes. So let's say that the patient decides to have stem cell therapy. To prepare for the surgery, they can consider notifying family and friends. They will have to arrange post-surgery transportation because they can't drive home following the surgery. They will also have to prepare clothing and personal supplies if overnight hospitalization is required. Since they will have reduced mobility, they will have to prepare their home for that as well. Furthermore, they will have to follow their orthopedic surgeon's recommendations regarding food, drink, and medications. On the day of surgery, they will have to deal with paperwork and insurance information. Of course, immediately after surgery, it is important to follow orthopedic surgeon's instructions on post-operative care. Then let's go on to rehabilitation. It actually varies between individuals, but for the first 3 months, usually it is okay to perform daily routine and activities. The patient can start driving again and return to seated work. They can do light recreational exercises like walking. 3 months later, they can return to low-impact recreational activities like cycling, golf, yoga, etc. They can also return to more physically active jobs like nursing or construction. They can return to daily activities that require strength and endurance. As for the 6 to 9 months, the patient can return to pre-injury sports-based recreational activities in an ideal situation. Long-term maintenance is required after the treatment. The patient will have to manage their frequency of visits and traveling time. There may also be side effects like arthralgia, that means pain at the cartilage area, joint crepitation, cartilage hypertrophy, and joint swelling. The patient can also provide community support after receiving the treatment. They can share their experience with other patients.